Let's get right to it and let's talk some health.
Building Community is an award-winning video series created by the Chester Housing Authority to stay in better touch with its residents, staff, and the general public during these times of social isolation. Thank you for tuning in as Executive Director Steve Fischer and Ulysses Butch bring interesting guests to discuss important topics of the day.
We're going to be talking health equity with Marina Barnett, Sheila from Penn, who is also the board member of the Chester Housing Authority, Dr. Monica Taylor from Delaware County Council, Ijjae Hill, who is a student at Widener University, and of course our own Steve Fischer, Executive Director of the Chester Housing Authority. Steve, we are here with number 19, you said. This is number 19 episode of this award-winning program we call Building Community. Thank you for having us, Steve.
Today's topic is health equity. Health, like some other areas, has its disparities. And we have asked a panel of people who, for the most part, their careers have focused on health. And so we're happy that they've been able to join us. Let's get right to it and let's talk some health.
Why don't we start with a face and a person that many people watching this would be very familiar with, because she's been around the city of Chester for a very long time, working very hard in this area of health. And that would be you, Miss Sheila Church. You are also the chair of the Chester Housing Authority's board. Thank you for joining us. Let's talk health equity.
Thank you for the invitation. I'm very excited about being able to share my feelings about health equity, and also about what efforts Penn, the organization that I work for, has done to try to meet the needs of this community. Now, I think a lot of people on this program are familiar with Penn Health Services. Penn has been in the city of Chester now for more than 40 years. It started out as a clinic for children, uninsured children, because there weren't many private providers who was providing services for uninsured children at the time. So Penn was created by our founder, Dr. Ijjae, who is no longer with us, but she was very instrumental in getting the children's and vicinity clinics started. So we provided services for uninsured children for many, many years. And then when we recognized that there was a need to provide medical and dental care to adults, the uninsured adults in the city of Chester, that's when we applied for funding to become a federally qualified health center. And what a federally qualified health center does is provide health care to individuals who are uninsured or underinsured. At the particular time that we started Penn Health Services, there weren't many private primary care providers that was accepting medical assistance. So we felt, we needed to meet that need, and that's how we became a federally qualified health center. Right now, we have about 17,000 plus patients in our care. We're located in Chester, we're located in Upper Darby, and we also are located in Coatesville, PA. Coatesville, PA, if not many people know, looks a lot like the city of Chester, has the same issues, the same racial breakdown in Coatesville, even though Coatesville sits in the county of Chester, which is quite different. The county of Chester itself, outside of Coatesville, is a very, pretty rich county, but not in the city of Coatesville. So we're there as well. About 97% of our population live to under 200% of the poverty level. So we're dealing with people who we're always trying to assist them with getting what we consider to be quality health care, in addition to what we consider to be equal equity, health equity. We've become involved. We've been an organization that has been certified to help individuals apply for health insurance. Right now, the state of Pennsylvania has a platform called penny.com. Prior to this year, we were under healthcare.gov. So we've always had staff prepared to help individuals secure health insurance either through nowpenny.com or through Compass, the state platform for insurance. We think that's really important for people to become insured. A lot of people don't think that they are insurable, and a lot of folks aren't insurable. And that's why we provide services to people who aren't insurable, and also try to help people secure insurance.
Is health equity mainly about access to insurance, or is there more to it than that? And I'll throw that out to you and anyone else who wants to answer.
Oh, it's definitely more to it than insurance. It's definitely more to it than insurance. It's making sure that the services that are needed are accessible, that they meet quality standards, that our providers are providing quality standards, or adhering to quality standards. We think it's important that it's not only physical health. In my opinion, health is not just physical; it's also mental, psychological. We provide an integrated practice at ChestPen, where we have folks who are coming in for primary health care also have accessibility to a behavioral health counselor, even though we don't consider ourselves a mental health provider. We still have that integrated practice at ChestPen. So yeah, health equity, in my opinion, is much more than just accessibility.
Steve, one of the things I was hoping Dr. Barnett could deal with for us is the point that we were making before we started, and that is that sometimes people confuse equality and equity, health equality and health equity. Is that something you could speak into, Dr. Barnett?
Sure. So equality is everybody gets the same thing. And assumes that we all start at the finish line and they say go, and we all go at the same time, right? And so you can give everybody the same thing. But equity is you get according to need. And so sometimes when we look at particularly American history, what we realize is that not everybody started at the same finish line. Some people started at the finish line. Some people started 20 feet behind the finish line. Some people started an entire mile behind the finish line. And so you may need to adjust the supports that you are given based on that. And so often the way that we depict that is, if you think about 3 different people. I'm a tall person, I'm 6 foot tall. Ijjae is a little shorter than me, right? And so if we're standing at a fence and Ijjae, the fence is covering us and we're trying to watch a softball game, Ijjae is below the fence. I am below the fence too, but if I give the same support, if I give her a box, she gets to stand on an egg crate and I get to stand on an egg crate, not an egg crate, I guess a milk crate, let's say a milk crate, they're the same size. Well, the milk crate that Ijjae is standing on still doesn't lift her above. She still can't see the game. I can see the game, and that's fantastic. So that little bit of support that we both got allowed me to see it, but not her. But equity would mean that I would be able to get the support that I need so I can see above that fence. But Ijjae's box needs to be a little bit taller so that she could see. And then one of the best ways to provide equity is to take the fence away altogether, or at least make it so that anybody, regardless of what height they were, would be able to see it.
You said you had a rock star here in this conversation. And before we go to Dr. Taylor to talk about some of the county's prep and support, I want to go to that rock star and talk about what you've learned here and that work that you've been doing in this period of time. And this has been I don't know if we can call it a tough period of time to do whatever work you've been doing, or probably the best. Maybe it's the best of times and the worst of times for you. Talk to us about the work you've been doing.
Yes, I would definitely agree with the last. It's been the best. I wouldn't say the worst, based on everything that I've been able to learn. My project is focused around COVID access and health equity. So we started a little bit more with the immediate effect, or the immediate impact, and we gave 19 tests, which have now been increased to 32 tests. So we'll be able to administer an additional 13 tests. The second aspect was to interview community leaders and get a better idea of the needs of the community, because we are anticipating that we'll be able to then interview community residents and really get a feel for what's working and what may not be working. We also are having a health equity panel on April 27th at 6 p.m. So this will feature some of the community leaders that I've had the honor of interviewing and kind of talking about different aspects of health equity, whether that be the social determinants of health, health equity more specifically in Chester, or how we can overcome some of these barriers that COVID has presented. So this has been an amazing experience, as I previously stated. I've really gotten a better idea of the needs in Chester, but also a little bit more nationally, because this is not just a Chester issue, it is a much larger issue. So we've been able to assess the needs and also be able to meet some of those needs of the community and hopefully fund additional programs and work with different services in Chester in order to continue to provide these services for people who need it.
Dr. Taylor, as we prepare to sign out here, what would you want people to know in closing about how to engage the health department that's being set up?
Love to have as much community support and community input as possible. So we've actually set up a site in transition. It's on the Delaware County webpage, it says like coming health department. And so we have some information about that. We have all the studies that we've done. And we also have a spot where it says get involved. Do you want to get involved with the think tanks? Do you want to have a listening session? Please go there, sign up, let us know, and we will get back to you because we are looking to have as much community engagement as possible. We want this to fill the need. So we don't want it to just be a health department that just sits there and does nothing. We want it to fill the need that we know is there.
Steve, as we prepare to step out of here, any final thoughts, sir?
Just this, we're extremely grateful to all of you for coming on and being willing to have this kind of conversation with us. I'm sure it's going to serve to have been informative to anyone who tunes in. Speaking as someone who operates in the city of Chester and has for 16 years now, we're a city that has a lot of health issues. Nobody can deny that. And they run the gamut. And some of you kind of outlined what some of those areas are, so I won't repeat them. If we can be the if we can be the vehicle through which people focus more on health and health equity, then we're happy to do that. So thank you for helping us, and let's move forward together, and not just during a pandemic, but always hopefully keep health, housing, health, education, all those interrelated things on the forefront, not just in times of crisis.